I therefore wanted to pursue PhD in disability studies because I knew that it would equip me with the knowledge of this complex social and environmental structures and values associated with disability, policies and practices on family support, and also on an understanding of the need for cultural competence in the care of people with intellectual and developmental disabilities and their families.
Welcome to the ReThink Desi Reframe series, where we challenge conventional narratives about social change, sustainability, and the South Asian community. Join me, your host, Arpita Sharma, each week as I have candid conversations with thought leaders, social entrepreneurs, researchers, activists, and creatives as we uncover the strategies, innovations, and stories behind their efforts to reshape our society. I'm Arpita Sharma, your host, and today's episode we embark on a journey of understanding and empathy, looking at the importance of intersectionality in discourse around disabilities. Growing up with a brother who had a rare genetic disability, it really shaped my experience profoundly. While issues of disability, healthcare, and navigating challenges would have been difficult in any circumstance, transitioning from India to the United States presented its own set of challenges. As a first-generation immigrant without strong social support systems, my parents faced difficulties in accessing the same level of support for caregivers as my brother did in accessing healthcare. Today, our guest is Dr. Sumitra Murthy, a mixed methods researcher at the University of Illinois, Chicago. Dr. Murthy's expertise spans critical areas including disability, family support, health disparities, and culturally appropriate interventions. Her dedication to improving the lives of those most impacted by social inequities is palpable in her extensive professional endeavors, while deeply considering the intersectional aspect of disability. Throughout our conversation, we'll unravel the layers of caregiving, family dynamics, and the pursuit of health equity for people with disabilities, with a particular focus on the importance of developing culturally informed care. This conversation is specifically for you if you have family members with developmental disabilities or if you know those who do. Dr. Murthy is currently recruiting participants for a health intervention for South Asian caregivers of developmentally disabled family members. Now let's dive in. So it's really nice to have you here with us today, and I'm so excited for this conversation.
Thank you for having me. It's my pleasure.
Well, I'd love to get us off by asking you, can you tell us a little bit about your journey and what initially sparked your interest in disability research and caregiving?
About my journey, our family, my husband, my daughter, and I, we moved to US in late 1990s. I'm a physician from India. I did my Bachelor of Medicine and Bachelor of Surgery, also called MBBS in India. And I completed my Master's in Public Health from Northwestern University. Then I worked at the Department of Disability and Human Development at the University of Illinois at Chicago before I decided to do my PhD in disability studies in the same department. So my interest in disability studies, stems from both personal as well as professional experiences. My sister-in-law is intellectually disabled and lives with my mother-in-law in India. And she needs assistance with many activities of daily living, communicating, and monitoring. My sister in law, in spite of having this moderate intellectual disability level, she has not been equipped for self sustenance. I see how, caregiving for a disabled child has caused physical, emotional, and psychological stress to my mother in law, in turn, kind of affecting her coping methods as well. I therefore wanted to pursue PhD in disability studies because I knew that it would equip me with the knowledge of this complex social and environmental structures and values associated with disability, policies and practices on family support, and also on an understanding of the need for cultural competence in the care of people with intellectual and developmental disabilities and their families. And I strongly believe that this knowledge, thus acquired, can help in improving the social and health outcomes of the family members as well as the people with intellectual and developmental disabilities. And I want to focus my research on bridging the gap between research on family support for people with intellectual and developmental disabilities and the outreach of the practices and policies to the community. So, this is, in short, my journey and the reasons why I got interested in disability studies and especially on caregiving.
It sounds like you've had really well motivated pathway in life in terms of pursuing and better understanding the approaches for doing disabilities research, as well as the potential for impact in this area. Developmental disabilities impact so many different families, both in the United States, globally, in South Asia, and there are very few resources that are really dedicated to supporting these individuals. So it's really wonderful to have you here to share your journey with us, and also to share some of the research that you're doing.
Yeah, of course.
You've come along this journey, and you started doing research that is focused on developmental disabilities. Can you provide an overview of your research on encouraging South Asian caregivers of individuals with developmental disabilities to engage in, in different techniques for taking care of themselves?
Actually, right now, I'm leading a research study called MindWalk. It's a mindful walking study for aging South Asian caregivers who are 50 years and above, of those who are caring for individuals with intellectual and developmental disabilities. And these are the caregivers who experience stress because of, their caregiving responsibilities. Now, when I say developmental disabilities, I just wanted to clarify that it's a severe chronic disability of an individual that is attributable to a mental or physical impairment or combination of those. And they're usually manifested before the age of 22, and they result in substantial functional limitations. So, some of the developmental disabilities include conditions such as autism, Down syndrome, cerebral palsy, spina bifida, and some others. So it was important, really, for us to take a look at, what could be done for the caregivers who experience stress. So this particular intervention is a 12-week mindful walking intervention that combines the cognitive training, which is the mindfulness, with the physical activity, which is the walking. Motivational texts and call them once a week to understand again their experience about mindful walking. This is a randomized controlled trial, which means that we will randomly assign the participants to either receive the intervention or not. And those who do not receive the intervention are called the control group, and they will be receiving some materials on the benefits of walking. And they will receive the training modules after the end of the study. So we are trying to see if there are any differences observed between the two groups, and if these differences are because of the intervention itself and not other factors. And we are really hoping that, this intervention would reduce the stress, improve the cognitive function of the caregivers. It will also increase their physical activity because it is a mindful walking intervention, and improve their overall self efficacy as well. South Asian caregivers have been neglected because of multiple reasons. There isn't enough data because most of the South Asians are lumped into the Asian um, group, and therefore not enough data is available because of linguistic and cultural barriers. They experience barriers to access to healthcare services or any other support services. So I think this study is one of the first few in the US that is being done for South Asian caregivers.
And I think there's also something very powerful about that here too, right? In that being able to do studies like this not only just helps those South Asians that are living in the United States, but it can really help to inform the types of interventions that could be done for South Asians in South Asia as well?
Yes, yes, absolutely. Um, the kind of barriers that caregivers experience, um, they might vary based on the country that we are looking into, but they definitely face barriers. So, for example, here in the US, the barriers are because of cultural and linguistic barriers or obstacles that they have, and lack of cultural competence on the provider's end. Whereas some of the barriers that South Asians face in their own countries is lack of awareness, lack of education, lack of health literacy, and then lack of support from the governments, or lack of support from community organizations. Uh, there are multiple other reasons, but definitely caregivers of people with like intellectual and developmental disabilities particularly face these barriers. And one common thing that we see is that they do experience a lot of stigma and discrimination. People not having enough understanding about what intellectual or developmental disability mean, and also because of the cultural and religious beliefs that they ascribe to what disability means. And there's a lot of stigma and discrimination which actually adds to the stress that the caregivers feel, and the mental pressure of caregiving.
That's true, both I think within the South Asian context and in general, in all communities in some way, for those facing disabilities, whether they're developmental or they're physical disabilities. I can definitely relate, having had a brother with a physical
Yes.
disability. I'd love to know, what do you think are some of the unique challenges that South Asian caregivers, of individuals with intellectual and disabilities, they face regarding their own physical activity and exercise, and really just in general taking care of themselves?
Yes, yes, that's a great question, because South Asians in general, they have a higher risk of developing conditions such as diabetes and cardiovascular diseases, and unhealthy dietary habits and physical inactivity. Coupled with genetic predisposition, they seem to contribute to this higher risk. Now, physical activities such as walking or participating in sports and recreational activities seem to be lower among South Asians in comparison with the general population here. For South Asian caregivers in particular, I think the caregiving responsibilities may limit the time available for them to engage in physical activity, in particular leisure time physical activities. Actually, several studies reported that South Asian women were less physically active compared to their male counterparts. Additionally, women do not engage in certain types of physical activity because of certain cultural expectations in some religious and ethnic groups, and moreover because of caregivers' limited access to support services for themselves and their family members with intellectual and developmental disability. South Asian caregivers end up taking, much more caregiving responsibilities, and therefore, again, they experience elevated stress, mental pressure, and then they neglect to take care of their own health and well-being. Now, another challenge that South Asian caregivers face is, again, as I mentioned before, there's low awareness and education on the benefits of physical activity and also mindfulness practices to kind of improve their physical and mental health. In addition, they generally have a lower health literacy compared to other populations, especially in US. The white caregivers, because of cultural and linguistic barriers and limited access to educational materials as well. So these are some of the unique challenges that South Asian caregivers face.
How do you navigate kind of that cultural sensitivity and adapt interventions to be more culturally appropriate for South Asian communities? Kind of given that, and I think it's really valuable just like knowing you are a South Asian, and you have deep roots within the community, and you came here as an immigrant yourself. So I think that provides a lot of value. But for those who are interested in kind of that process and some of the best practices that you've kind of seen in that process, can you please share some of that?
Yeah, sure. But before going into how to navigate, I think it's very important to understand how do cultural factors influence the attitudes and behaviors of South Asian caregivers, right? Um, some of the cultural factors and beliefs that kind of influence the attitudes and behaviors of South Asians in general are like gender roles, misconceptions about health and, for example, physical activity, and also like cultural priorities. As I mentioned before, men and women usually have distinct roles in a South Asian family structure. So, expectations from women in South Asian household often prevent them from starting maybe an exercise regimen or any new lifestyle or behavioral change program. Although it is changing, traditionally South Asian culture has emphasized, physical distancing between men and women. Therefore, when it comes to exercise or any other health interventions, many women only feel comfortable in women-specific groups and feel that it is culturally inappropriate to exercise around men. And there is, as I mentioned, there are many misconceptions about health and physical activity, and this is, like majorly because of lack of awareness. And additionally, I think social priorities among South Asians make them to deprioritize, their own health as part of their daily routine. Mhm. A common cultural belief is that time outside of work should not be spent on leisure activities for oneself, such as exercising, but instead should be kind of used to help or care for or spend time with family members. So South Asians does sacrifice health and physical activity for one's work or family. And South Asians are involved in like daily usually religious and spiritual practices. They practice alternative medicine as well, and therefore they kind of seem to find less need for other lifestyle changing practices. So these are some of the cultural factors that define South Asians generally. And it's really important to navigate cultural sensitivity and adapt interventions to be culturally appropriate for South Asian communities. And first of all, I think any professional, whether it's a researcher, whether it's a service provider, or health practitioners, it is really important to take the time to understand these cultural values, beliefs, and practices of South Asian communities, respect them, and then incorporate them into their programs or interventions. Now, since South Asian culture is collectivistic, it's family centric, and spirituality is one of the underlying fabrics of South Asian cultural life. It use of traditional spiritual and healing practices, community support networks, and family centered approaches should be encouraged. And to do so, it's important to conduct needs assessments of the specific population, because until we understand the needs of that specific population, we will not be able to develop culturally appropriate or culturally relevant programs for them. In addition to doing this needs assessment, it is also important to engage with community members and community leaders before kind of adapting any intervention or any program to South Asian communities. And some ways of these community engagement, methods include setting up advisory boards, that constitute
Yeah.
community members and leaders from South Asian community, conducting listening sessions and focus groups with South Asian stakeholders. Next, it's important to provide relevant materials, like either the research materials or resource materials in appropriate South Asian languages if needed. Also, culturally appropriate language and communication styles need to be used. And if the materials are in English, plain language must be used. These are very important things that need to be considered by any of the, like professionals, researchers, or service providers to keep in mind before they develop any programs. Now, outreach and dissemination of these programs need to be tailored to these cultural values and priorities. For example, they can use culturally relevant imagery or narratives when they are disseminating information. And again, most important of all, the staff members who are involved in delivering these programs and interventions, they should be culturally competent and sensitive to the needs of the South Asian community. And for that, the staff members should be provided culturally competency training, cultural humility training, so that their understanding and responsiveness to cultural aspects of South Asians is enhanced. And finally, I think getting feedback from people, South Asians, community members, or research participants themselves need to be sought. Um, and that needs to be done again to kind of assess whether the programs that have been developed are culturally appropriate, they are effective, or whether it is really impacting the South Asian community, and also to kind of identify areas for improvement and adaptation. So I think all of these have to be taken into consideration, and they're not exclusive of each other. They all have to be considered together when any programs are delivered or any research interventions are being developed. All of these factors need to be considered. And that is how you navigate cultural sensitivity.
There's a lot of value in first understanding the specific behaviors and cultural approaches, or just the general lifestyle and perspective that South Asians tend to bring to the table, and working with those needs and with those behaviors rather than trying to subvert them in some way, but really focusing mainly on the intervention that that researchers want to implement and see if that can be effective or not.
Yes.
In your opinion, are there some areas where healthcare and support services can better serve the South Asian caregivers and individuals with intellectual and developmental disabilities? I know you mentioned a couple of these already, but is there anything specific that you wanted to share?
Sure. As you mentioned, many of the ways to navigate cultural sensitivity while adapting interventions that I just described now are also applicable to improve the healthcare and support services for South Asian caregivers, and also their family members with intellectual and developmental disabilities. Now, some of the major difficulties that South Asian caregivers face are, understanding health-related information because of, limited English proficiency, or managing healthcare tasks such as managing medications or coordinating care or services. And as I mentioned before, language and cultural barriers is huge. It's huge when when they have to talk with providers, they face these barriers. So to address these, again, there is a need for culturally and linguistically competent services and resources for South Asian caregivers. Such as making information available in the caregiver's own language. Training the providers to be culturally sensitive, and again avoid assumptions about a family's cultural practices and beliefs. Healthcare providers need to use professional interpreters wherever possible. They need to include families in decision making, because South Asians are, a collectivistic society, with family being the central essence of societal unit. And therefore, families need to be included in decision making, what is called the family centered approach to care. And wherever possible, provide culturally competent referrals and resources, to resolve issues. Next, healthcare and other service providers also, they must work with the social and cultural framework of South Asian families. And that can be done again either by involving cultural experts or and or by creating partnerships with South Asian serving community based organizations. These organizations have a working knowledge of different South Asian communities, so the service can be delivered through liaising with such organizations. And then service providers need to connect with South Asian caregivers and their family members with disabilities. um, you know they need to connect them with advocates from their own communities, and also help or encourage them to be part of support groups. So the service providers need to be aware of the cultural nuances of the community that they are serving, so that when they actually kind of look at how they could support these South Asian caregivers or South Asian people in general, then they are able to provide culturally specific supports. And many of those have to be connected or have to be thought through based on the cultural beliefs of the community that they are serving. And that is very important.
I really appreciate how kind of detailed that is, and it's a lot to chew on. But it's also these are kind of very specific types of interventions that could really improve the outcomes of an overall a research study or an intervention that's taking place by a healthcare service provider. You have been kind of working on looking at interventions for caregivers around intellectual and developmental disabilities. Can you share some of the future direction or goals of the research in this area?
So the mindful walking intervention that we are working on right now, we really hope that this intervention will reduce caregiver stress, improve their cognitive function, increase their physical activity, and also enhance their self-efficacy, as I previously mentioned. This mindful walking intervention, this can be implemented easily, and it is user friendly because it uses simple elements and technologies. And because of these reasons, we are sure that the intervention would be accepted easily by the relevant stakeholders, and can be conducted with caregivers with diverse demographic profiles. Also, my future goals are really to conduct more culturally tailored, innovative intervention studies to improve the lives of caregivers of people with intellectual and developmental disabilities, by improving their physical and mental health and overall well-being, and and include a lot of cultural aspects of South Asian caregivers. I'm not focusing only on South Asian caregivers in my overall research. Um, we are trying to look at caregivers of individuals with intellectual disabilities. We also look at Asian caregivers in general, because there is commonality between Asian societies, which is again family being the most important social unit. um, Many Asians, East Asians, South Asians, Southeast Asians, they all have this daily religious practices. They're spiritual. They have alternative healing practices. So there are so many commonalities. So my future directions or goals include research with Asian population, South Asian populations as well, and especially with families and caregivers, because sometimes, as I mentioned before, the caregivers always neglect their own overall health and well being, and not enough research was done earlier. Now, family support as a discipline of research is gaining momentum, but I would like to focus on Asian and South Asian caregivers.
How do you envision the broader impact of your research in improving the lives of South Asians and Asian caregivers, and for those with intellectual and developmental disabilities?
That's a great question, Arpita. As I mentioned, because South Asian family caregivers, they experience, increased psychological stress because of various reasons. They could be like lack of access to services, because of cultural and linguistic barriers, because of stigma and discrimination. And this is in addition to the caregiving responsibilities, right? Um, you know, we are hoping that the findings from this project would be able to contribute significantly to improving the lives and well-being of like older, under-researched and underserved populations living in the US, especially the South Asian population. And we are also hoping that like findings from this project will kind of provide evidence-based data to support larger scale study proposals. We plan to disseminate the findings to a broader audience, through conferences, publications, and we are also planning for like outreach strategies to organizations serving these populations, so that they can incorporate these trainings as part of their programs. Additionally, our research can help increase awareness and understanding of the challenges that are faced by South Asian caregivers within the broader community. I'm hoping that this is just a beginning to conducting more research to improve the lives of families of individuals with intellectual and developmental disabilities in the US and also globally.
On that note, I would love to ask, so for those who are interested in participating in the study, or know of those who might be interested in participating in the study, how can we get in touch with you? And how can we, put our name on that list to be part of that group?
Oh, wonderful. Thank you for asking that question. So I can share with you the QR code and the link for the screening questionnaire for our study. The participants can also reach me, at my email address, which is smurthy@uic.edu, smurthy@uic.edu. And yeah, these are the ways that they can reach out to us. And if they are interested to participate in the study, we will screen them and see if they are eligible for the study or not. And once they deem eligible, then we will contact them with further instructions, with first starting with consenting them. So anyone who is interested in the study, please do reach out to us through either contacting me or scanning the QR code that I will send you, or clicking on the link for the screening questionnaire. We are planning to recruit 50 participants for this study. So once we recruit the 50 participants, then it will be closed for now. But we are planning to, as I told you, scale this up with, like a bigger studies, and want to add more components to the actual intervention itself. And therefore, we will be reaching out again for those studies. But for now, for this study, it is just 50 participants. So once we fill those 50 participants, then we'll be closing it. We won't be recruiting anymore. So we are hoping by that, by this summer, we are able to launch the intervention for the participants, or rather sooner if possible, by April, if it's possible, because it's a 12-week intervention, and then we'll be following up with the participants after the end of the study. So
hopefully those listening know that you can always reach out to Dr. Murthy and be able to connect with her to this particular type of research around caregivers of those with intellectual and developmental disabilities. If you know folks who would be eligible to participate in the study, to get out this information as soon as possible so that they have the opportunity to test out some of these interventions and see the potential long-term health benefits that can come of it.
Yes. And for this study, we are focusing on caregivers who are 50 years and above specifically.
Yes. So those parents, this is for those of you who are listening around my age and you got some parents who you know could benefit from this, or some relatives, those are the people to reach out to. It was really wonderful having you here today for the conversation, Dr. Murthy.
Thank you so much. Thank you for giving me the opportunity to share my research with you and with the audience. It was a pleasure.
Yes, thank you for joining us. And it's been wonderful having you here as well. And we hope to have you back in the future.